Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specialising in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Today my guest is Dr. Nicola McFadzean, who's actually English, the same as me, and she grew up in Australia and she's now in San Diego. Thank you for joining us today, Nicola.
Oh, you're so welcome. Great to be here.
So, when did you first decide to get into medicine?
Well, it's interesting. I grew up, as you mentioned, mostly in Australia. I left England when I was 6 and had a very sort of healthy mom, very healthy upbringing in sunny Sydney. And so I sort of got interested in the fitness industry and came into natural medicine that way. I never was really set out to study medicine per se. I worked, like I said, in the fitness industry. Then I wanted to study nutrition, so I had a bit more to offer. And then from there, I got introduced to naturopathy in Australia, and that definitely caught my attention. So I did study in Australia. I did a 3-year diploma of naturopathy, and then you could convert that onto a Bachelor of Health Sciences in naturopathy. So that's what I did. And then when I came to the States, I got introduced to naturopathic medicine. So in America, you can actually be a naturopathic doctor. That qualification just doesn't exist in Australia, and I think not in England either. So I did that. I went to Seattle and I studied for 4 years and got my doctorate of naturopathic medicine, and then moved to San Diego in 2003.
Mm-hmm. And along the way, had you heard of LDN, or was it later?
It was early in my days in practice. When I first went into practice, I was very fortunate. I was invited to work in a clinic where the medical director was a fairly well-known autism doc. And so I was brought in to do more women's health and hormones and things like that. But ultimately, he ended up sort of training me in the autism work. And so I was introduced to LDN around that time through him.
Mm-hmm. And what about the usage of LDN? Was it just in autism, or did you prescribe it for other things as well?
Well, I've always had quite a specialist kind of practice. So for my first few years in practice, I was doing mostly autism, and I did use it fairly frequently in those kids. But then I started seeing Lyme patients. And so fast forward to today, the majority of my practice is Lyme, probably 95% is chronic Lyme. And so then it was sort of a natural transition to be using LDN with those patients too.
Mm-hmm. Before we talk about Lyme, what was the success rate, would you say, for LDN as a treatment for autism?
I experienced pretty good success with it. I got good feedback from the parents of how it was helping their children. So I really liked it as sort of part of what we did in conjunction with dietary changes and treating their gut and addressing candida and all those kinds of things. So I think, with any of these sort of chronic health issues, there's not one thing that's going to be like the be all and end all. There's just no one thing out there on the planet like that, really. So I think as an adjunct therapy, it showed really good success. I liked it a lot.
Mm-hmm. Oh, great. And the Lyme patients, when a patient comes to you with Lyme, how do you go about unravelling exactly what needs to be treated?
Yeah, well, that's a great question because there's a lot in that population. It's very complex. So it's not just, chronic infection, treat the infection and everyone lives happily ever after. There's a lot of complexity. So it's always about sort of being the detective and trying to figure out the different elements that are most, at work in that person. So it is chronic infection, but then there's a lot of immune dysregulation that happens. So I sort of put in the category of chronic infection, I put, the infection itself, typically immune suppression in a chronic illness like that. But then this sort of, often this sort of propensity to autoimmune process in the body, and then chronic inflammation that comes, with all of that. So that's just the infection piece. And then we have the adrenals that have usually got absolutely tanked in the process of all of this. Thyroid can be thrown off. I see a lot of Hashimoto's thyroiditis, which is, again, another area I think the LDN comes in so handy. And then, mold toxicity, heavy metals, there's so many different things that play. So it's just a question of really kind of trying to gather as much information from the patient, see what their history has been, do as much functional diagnostic testing as possible, and then kind of prioritizing and then just sort of, starting the ball rolling, knowing that we can't do everything at once. Mm-hmm. And working a lot based on clinical presentation. Sometimes, testing for Lyme can be a little bit unreliable. So we have to just kind of put all the pieces together and figure out what makes sense.
Mm-hmm. How long do you think normally it takes to start a patient down the right road when they come to you initially? I know you have to take all the details and do testing and investigating, but how long do you think that normally takes? I know it would vary, but if you were put on the spot and had to pick a time frame, what would it be?
Well, I get people up and running on a treatment plan the first time I meet them. Okay. But often I do something. I very, very rarely do I just send someone off and say, okay, we're going to do all these tests and then come back, because a lot of people come to me already with some testing already, and there's always a place we can start. Mm-hmm. But if we're waiting on testing before we start, antimicrobial therapy, for example, I'll still be doing something to try and get them feeling better. So that happens right away. And so I typically will start people on natural therapies first. I do prescribe antibiotics in some of my patients, but I will never do that in a patient I've just met because I just don't know their body well enough yet. Mm-hmm. So some patients I'll actually prescribe LDN right out the gate in the first visit. If, we're waiting on labs, if we're really trying to help with things like pain and anxiety and insomnia, and the things that I find LDN most helpful for. And it's just a question of prioritizing then, because when I start someone on an LDN, I really don't want to do anything too much else different for those first 3 or 4 weeks, because I want to see how they respond to it. And because I have chosen now to titrate everybody up on dose. Mm-hmm. Whereas I used to start patients at the 4.5 milligram dose if they're an adult. Now I start everyone lower at like 1.5 and have them do that for 5 or 6 nights, go up to 3 milligrams, have them do that for 5 or 6 nights, and then go up to 4.5. Mm-hmm. And I found since doing that, I barely get any of the sleep disturbance that I saw a little bit in maybe 10 to 20% of patients when I started at the 4.5. So it's a question of like, when do we have that 1 month gap where we can introduce the LDN and, really, to be fair to it, have no other variables changing so that we can see how it's doing.
Mm-hmm. And how long would it take to get a patient into remission?
That's the $1 million question. So I tell my patients that to think about it as 2 years of treatment. And sometimes it's longer than that. Honestly, rarely is it less than that. I do have some patients that I put them on some herbs and they come back 6 weeks later, like pretty much symptom-free. That's the exception, unfortunately. I wish that happened more. So I usually tell them, anticipate a good 2 years or more of treatment. but it's not to say it should take that long to get them on the road to recovery, but to really get to that point that we can confidently say they're in remission.
Patients with Lyme who are in remission, do they still have any symptoms at all? Do they still know they've got Lyme but are learning to live with it?
Yeah, that's a really, really good question. And I've seen a range of different things. So let me backtrack. When we say we're putting patients in remission, we never say we cure Lyme once it's chronic. So if someone's just been bitten by a tick, they get the bullseye rash, they get enough antibiotics, then yeah, we can potentially eradicate Lyme at that point when it's a very young, new infection. So in chronic Lyme, we do use the words remission. And I see a range. I do have some patients that are sort of 90% of where they were before. And there may be some residual symptom. We can't necessarily know that they're all attributed to Lyme. Like sometimes other things happen and other stresses are at play on the body. And then those people, a lot of people will say, gosh, well, 90%, I'll take it. I was at 30% for so many years, so 90% feels great. And if this is how I'm going to be for the rest of my life, I'll take it. I can happily live with that. There are other people that do have sort of elements, like they can have flares along the way of symptoms. And that's really frightening for people because I know when people are in remission, it's almost like this sort of dark storm cloud over their shoulder. Like they're always sort of waiting. Any symptom, it's so tempting to think, oh no, this is Lyme's coming back. But I do have some people that just do have flares along the way, and we need to go in and do a month or so of treatment just to knock it down, and then they're okay again. And then I have some people who seem to go into remission and then pop up again the following year. I've seen this as a bit of a pattern. They pop up again the following year and say, I'm having some symptoms again. But when we investigate, it's actually adrenal stuff. It appears not to be the actual Lyme infection kicking up. It appears to be more a secondary adrenal fatigue. So I think sometimes people start feeling better. They sort of slack off on their diet a little bit. They go off some of their supplements. They just don't want to have to work as hard as the regimens. Mm-hmm. And so I think sometimes the adrenals get forgotten, but they take a while to recover. And so I've seen that a few times where people have come back feeling like they're having symptoms, but once we did adrenal work, then those symptoms went away.
Well, that makes sense, doesn't it?
Yeah, it definitely does. Mm-hmm. And it's natural to me to think that people, when they start feeling better, it's easy to go out and overdo it because they've missed out on so many things for so long. And it's easy to kind of not keep up on as intensive a, regimen of detox therapies and supplements and diet and, all of that. That stuff is hard to maintain. I think when people feel better, it's just a natural sort of temptation to not do as much treatment. Mm.
So I know that everybody can catch other things, just because you have one condition doesn't mean to say you can't have other things as well. And you were talking about adrenal fatigue. For gut health, how do you go about treating that? Well,
the first thing to do is remove anything that's causing inflammation in the gut. So I try and get people off gluten, dairy, get them off whatever food intolerances they might have. So I do a lot of IgG food sensitivity testing just to see if there's any foods that are inflaming a person's gut that they might not be aware of. And gluten is an obvious one that we know is quite inflammatory, mm-hmm. but some people are sensitive to garlic or bananas or pineapple, and they wouldn't necessarily know that. So I do check and sort of work on the diet first. Mm-hmm. And then I'll usually do a combination of stool testing. And I like a test called a microbial organic acid test because it has metabolites of Candida and Clostridia. And so I do stool testing to check bacterial imbalance, make sure there's no intestinal parasites showing up, do the microbial organic acid to look at Candida and Clostridia, and kind of work on getting the microbiome back in balance. And then at the same time, we want to work on healing the gut. So I've used some lignite formulas. I've used colostrum, liposomal colostrum, L-glutamine, things at the same time to calm the gut and heal the leaky gut.
Mm-hmm.
And, usually between leaky gut, bacterial imbalance, parasites, yeast, getting inflammatory foods out, then that starts to put things back in the right direction.
Mm-hmm. I mean, there are doctors that say if you've got candida, that LDN doesn't work as effectively. And I've had so many people ask me, how do I know I've got candida and how do you treat it? Could you answer that for me?
Well, there's a number of different ways to test for candida. So, just looking at symptoms in the body, if somebody's got gas, bloating, white coating on the tongue, foggy brain, fatigue, they're all kind of indicators of candida. But from a testing standpoint, you can do blood antibody testing, so IgG, IgA, and IgM markers to candida. You can do a stool test, like a comprehensive stool analysis, and it will often show up there. But my favorite, like I said, is this microbial organic acid test, because those metabolites, one of the key ones I look for is a rhabinose. It's a metabolite of candida, and so it sort of quantifies it. It gives you a clear number. So if your rhabinose is, 84 or whatever, and then you go about doing your antifungal therapy, and then you check it again, and it's down at 50-something, you're on the right track. You're not finished yet, but you're on the right track. Whereas you don't get that clear-cut feedback through the stool testing or the blood testing.
Mm-hmm. And how do you treat it?
And it's easy for kids, too.
Mm-hmm.
The urine test is easier for kids than having them do a blood draw.
Oh, yes.
So treatment for candida, there's a whole host of different things. I use a lot of herbs, herbal blends and things like that in my treatment. The first thing is to sort of look at where is it coming from. Like, we all have candida, that's fine, but where is the overgrowth coming from? I do use some prescription antifungals in my practice, especially if I do have patients on long-term antibiotics. I will often put them on nystatin, which is a prescription antifungal, but it doesn't absorb systemically, so there's no stress on the liver. It's very safe. It just goes to the gut, kills yeast in the gut, gets excreted. For that very same reason, it's not as effective for systemic yeast issues. I do use some fluconazole, which is another prescription antifungal. I find it very effective. But largely I'm using a variety of different herbs, grapefruit seed extract, pau d'arco, clove. I use some essential oils, can be good antifungals too. And it just depends on the sensitivity level of the patient. But there are some formulas that I really like. Some people who are really sensitive do better with more like an enzyme kind of supplement to help break down the yeast wall, the cell wall. That can sometimes be helpful without causing as much die-off. But the key with candida is sort of keeping it on its toes. So there are some times where I'll have somebody on nystatin long-term. And again, going back to the kids with autism, I found nystatin very effective in them. And often I would find it would continue to work for several months. But we do want to be conscious with candida of changing things up and rotating formulas just so it doesn't get sort of, resistant to what we're giving.
Mm-hmm. My experience of people with Lyme disease, they tend to be a group of people, along with those with fibromyalgia as well, who seem to be ultra sensitive to virtually anything, drug-wise, supplement-wise. They find it difficult to tolerate. Have you found that?
Some of them, yeah. I think as a population, because there's so much going on in their system, that yes, some of them are hypersensitive. And I think that probably comes down a lot to genetic issues with methylation and things of that nature. Mm-hmm. So some are quite highly sensitive and some are less so. But the trick is always just to start with very low doses of things and work people up gradually, because especially with candida, there can be that die-off kind of effect. And I use a lot of binders too with my patients, activated charcoal, peripherite clay, things like that to help draw toxins out of the body, especially if we are doing any kind of therapy that's killing bugs, whether they be Lyme bacteria or candida. Mm-hmm. So doing binders can help to get them out. And then obviously replenishing with probiotics and things like that. But yeah, you just have to assess every patient and their sensitivity level and then kind of go accordingly from there.
And as we were saying before we started recording, many of these people suffer with depression and have been told by doctors that, there's nothing wrong with them, they're just depressed, they need an antidepressant, and all these other awful symptoms they've got will go. So how do you go about treating depression in your patients?
So there's a couple of different ways to answer that, and it's based on looking at depression from a couple of different angles. Mm-hmm. So I see there's two elements of depression in my patients. One is depression is a very natural response to being in pain chronically, to being homebound, bedbound, not being able to be out in the world and in life and enjoying friends and family and children. And then, as a reaction to circumstances, mm-hmm. depression and anxiety are fairly understandable emotions. So that's kind of one half of it. Then we have the other half that the infections themselves cause depression and anxiety just as real a symptom as a knee pain or fatigue. So we've got this sort of double-edged sword that people are feeling depressed and they're feeling fearful and anxious about their situation. But then these infections actually, through inflammation in the brain, through messing with the neurotransmitters, working on their central nervous system and kind of creating depression and anxiety as well. So, to some extent, it's just a matter of treating the infections to help the depression. Mm-hmm. I do have some patients who do antidepressants along the way. I'm not categorically opposed to that. I think if that's the support they need while we're working on the underlying cause, then I have no problem with that. Mm-hmm. I'd rather than take an antidepressant than an anti-anxiety med, just because I've seen the benzodiazepines be a bit of a disaster case. But if that's what they need to get through while we treat the underlying cause, the difference is we're not just using it as a Band-Aid forever. Mm-hmm. We're using it as a support tool while we're getting to the root of the problem. So, I strongly encourage my patients to get counseling, something to help them deal with, navigating their illness and just the sense of loss and sense of grief and the fears that come up. And I'm a strong believer that a lot of Lyme patients have PTSD because of what they've been through in the medical system so far on their way to getting to the right doctor. Mm-hmm. And Bob Bransfield, who is probably our leading Lyme-Literate psychiatrist, he talks quite a lot about that. And I am in firm agreement. I think a lot of people do end up with PTSD and just through their whole experience.
And treating the underlying symptoms cause rather than treating the symptoms has to be the way to go, because like you say, using a Band-Aid, that's all it is if you are just prescribing medications to treat the symptoms.
Correct. We never want to do that just by itself. And that's true whether we're using pharmaceuticals or herbs. There's something called green pharmacy in our profession where you can just treat symptoms just as much naturopathically as allopathically. That still doesn't really help the patient to get to the underlying root cause. And that's one of our philosophies of naturopathic medicine is, find the root cause, treat the cause. Mm-hmm. But I also do, symptom relief is great. Don't get me wrong. Symptom relief can be really helpful. And in the case of depression, it can be life-saving. Some people get to the point of being suicidal. And if that's the case, then yeah, we need to get them stabilized before we can go any further. But, I also use amino acid therapy and natural agents to help take the edge off depression and anxiety as well.
Mm. Luckily, I don't suffer with depression, but I know quite a few people that do. And it would seem to me as though every day is a struggle when you are so depressed. And it must be awful.
I think it's truly something that we can't understand. By the grace of God, I have not suffered from depression either. But I I can't imagine. Sometimes when I have the flu and I'm feeling all sorry for myself because, everything hurts and I'm feverish and, it's just the flu. But we feel terrible when we have the flu. And I always say to myself, I'm like, oh, this is what my patients feel like every day, and really just I can't even imagine how awful that is, So I think the key, though, going back to what you're saying about they're being told that they're just depressed, it's all in their head. I mean, one of the things that I feel I can give my patient is that listening ear. Like, I will never tell my patients that they're crazy. I will never tell them that their symptoms are all in their head. I will never discredit them. And I think it's such a relief for Lyme patients when they do get to a doctor that understands. And there's a growing body of Lyme-Literate doctors. The ILADS organization is really growing and is really kind of sharing and educating other doctors in the world of chronic Lyme. So, so it's a growing body now of doctors that really do get it and want to help and don't just tell people that their symptoms are all in their head, because that's a shocking thing to do to someone.
It is. Not to be believed. I think that's when you feel so sick and every day is a struggle and you can't do anything, to then be told it's in your head. It must be awful.
Yeah. Second only to, oh, but you look great. That's another one that my patients talk about a lot, because Lyme is kind of an invisible illness. And so a lot of people, and they're told this by, close family and friends too, probably well-meaning, but still, oh, but you look so good. You don't look sick. You look great. You're fine. You look fantastic. And I got to say, like, some of my patients come into the office and they look like $1 million. They do. They've got their, their hair's done, their nails done, whatever. But if I really sat down and asked them about it, that coming in and putting themselves together like that, they could be out for days. They could be in bed for days just recovering from the effort it took to do that.
Well, I have MS, so I know where you're coming from with that one.
Right.
Yes, because when you've got a chronic condition, you haven't got it stamped on your forehead, have you? And people don't realise what you have to live with in a day. And I think for many people with any kind of chronic condition, if you were to put a healthy person into somebody else's body for a day and then ask them how they felt, the chances are they're going to feel depressed, but not being able to do a fraction of what they were normally able to do.
Absolutely. No, I agree with that. I mean, I remember once I had surgery. I had Achilles tendonitis for years and years and years. This dates back to my fitness industry days, just doing too much and not being too stubborn to not do it. And I remember I had a surgery on both legs at once. This was back in 2003. And so, I was casted and pretty much in bed. I was studying for board exams. So I was like, no pain meds, just have to sit here and study. But I was casted both legs. Wow. And I tell you, I mean, I was definitely feelings of depression within a couple of weeks, just that frustration of not being able to get up and move about and take care of my own needs. And it was hard. So, yeah, I can't imagine people who've been living with that for several years. It would take amazing courage and resilience just to live with that day in, day out.
And do you give telephone or Skype consultations?
Yes, absolutely. I work with a lot of my patients by phone or Skype. So, yes, I've always done that. And
are there certain states you can do it in, or can you do it throughout the US?
I can do it worldwide. The biggest restriction on doing that is I can't prescribe anything for a patient I've not met in my office at least one time. But a lot of people, if they have a local doctor to do the prescribing, I can still give recommendations.
But it has been amazing talking to you, Nicola. We've come to the end. Anybody in the San Diego area, if they want to get hold of you, how do they do that?
So through our practice website, which is restoremedicine.com, and Restore does not have an E on the end, so it's RESTOR medicine.com. I also just want to mention I've just published an online course on the subject of Lyme disease. It's 25 hours of teaching. Pretty much everything I know about Lyme disease is in there. So The website for that, if anyone is interested in looking that up, is Lyme-Ed.com. So it's LYME-ed.com.
Wonderful. Well, thank you for being such an amazing guest today.
You're so welcome. It's great to be here.
This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specialising in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.